Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So, as we know, we were discussing series of case discussions related to approach to cough in children. So today we'll have another important case, and this is the case. A 4-year-old child presented with a mild fever and cough for the last 3 weeks. Okay, the fever is very mild, but it is there 101, 100, 101, etc. And also there is a cough, again, it's also a mild for last 3 weeks. Okay, the age of the child is 4 years. Now, there is no past history of similar illness. Child has got no any past history of similar illness. So far, the child was doing well. Now, since last 3 weeks, child has got this problem. The child is not gaining the weight for last few months. Okay, this is a complaint of the mother. 3 साल तक बच्चे का वेट गेन बहुत अच्छा था. अभी पिछले 1 साल में जो है बच्चे का वेट गेन इट्स नॉट सो गुड. ओके, सो चाइल्ड इज नॉट गेनिंग द वेट वेरी वेल. पतला होता जा रहा है. ठीक है, लास्ट फ्यू मंथ्स. एंड चाइल्ड मदर इज ऑल्सो टेलिंग दैट ही इज नॉट मच एक्टिव एंड ही इज नॉट एनर्जेटिक ऑल्सो. ओके, बहुत जल्दी थक जाता है. ठीक है, सो दिस आर ऑल द कंप्लेंट्स ऑफ द मदर. खाना खाता नहीं है. नो देर इज when you see first 3 4 lines of this history, see, fever is mild and cough is mild. I told in the beginning itself, in the first class itself, when the fever is mild and cough is mild, you should be always be cautious. Severe cough, no problem. Upper respiratory tract infection, no problem. Mild severe fever, definitely either it may be a viral fever, okay, or if the other symptoms are there, localized symptoms are there, it's a bacterial fever. But a mild fever and a mild cough should be always dangerous and it should be taken very cautiously. Okay, now they are telling there is no past history of similar illness. That means that it is not a recurrent illness. Okay, viral infections are recurrent. So again, this suggests that this is not even a viral infection, because viral infection will not start with a mild fever and mild cough. Viral infection will start with acute fever, and cough is also acute. Okay, now mother is also telling that he is not gaining the weight. That means growth velocity chart has been fallen. Okay, there is a disturbance in the growth velocity chart. That means this is a progressive disease. Okay, growth is gradually now falling. That means this is of course a problem maybe since last 3 weeks as appreciated by the mother. It may be running since beginning itself, previously also. Nobody knows that. But the growth chart clearly indicates that this problem is there since beginning, isn't it? All the symptoms started 3 weeks back. Mother is telling that, and when you see the growth chart since last 1 year, so child has gradually fallen the weight. Therefore, I always say the growth chart has to be maintained. Okay, so before presentation of the symptom itself, you can identify the problem if you maintain a growth chart. So when you see the growth chart is showing that if the growth is falling since last 1 year, that means problem started since last 1 year itself, or some 6 months itself. Now it is started with the presentation symptoms. So growth chart is showing that growth chart is falling. Okay, meantime mother is telling he is not active. Okay, dull child, a sick child. Okay, so dull child and sick child is always suggestive of a bacterial infection, always suggestive of a bacterial infection. So he is dull and he is not energetic. Loss of appetite is also there. And when I asked further, when I got this much of history, when I asked further, and there is a history of tuberculosis. So mother says that yes, the child has got a contact with his uncle 5 months back. 5 months back, child has got a contact with his uncle who has got the tuberculosis. Now in children, actually, history of contact with the tuberculosis is very, very important. Even one single contact with any person who has got tuberculosis can be a suspicion for tuberculosis in children when the presentation is there. Okay, mild cough, mild fever, loss of weight, loss of appetite, less energy, sick looking child. Everything is suggestive of tuberculosis, and mother is also giving the history of tuberculosis. Now, usually adult will go into spread the tuberculosis to the children, and children will not spread the tuberculosis to adults. Okay, because tuberculosis may be a airborne infection or droplet infection, basically droplet infection. And in childhood tuberculosis, except in severe cases, there is no formation of the sputum. But in adult tuberculosis, there is always a formation of the sputum. So it is adult who is spreading the disease to the child, and child will never spread the disease to the adult. So child come in contact with an adult person having tuberculosis is also a very important history of contact that has to be taken, and that is there. Okay, but mother is telling that uncle is treated now and he is now well, no problem. Still history of because although he is treated and he is well now, he would have been transmitted the disease to the child because he has got sputum production, and there is every chance that child is get infected. Anyway, now chest x-ray was done. A chest x-ray, previous chest x-ray is also available, and it shows that there is some mediastinal lymph nodes, and mediastinal lymph nodes are getting enlarged, and also Montos test is also done, and mother is telling that is negative. Montos test is negative. But they have also taken some fluid from the abdomen. She is telling that is gastric aspiration test, and that is positive. This is again in children. Montos test may be negative. Okay, AFB sputum AFB, it is not possible as the child will not produce any sputum. Child with tuberculosis, there is no formation of sputum, therefore there is no question of a acid fast bacillus test, AFB test, sputum test. So one of the best method that we will follow is a gastric aspiration test. Okay, we collect the fluid in the early morning by gastric aspiration, and that will be analyzed. And mother is telling that has been also done, and it was positive. But Montos is negative, and mediastinal lymph nodes are there. Now, when you look into this case, now it's very clear that this is a case of tuberculosis, isn't it? History of contact. See, whenever there is a history of contact is there, you have to suspect for more than 50% suspicion, and this will be followed by some different investigation to confirm that. That's all. History of contact is very, very important, because as adults always spread the disease to the children, a child coming in contact with any adult having tuberculosis is a big history. Okay. Now this is a case of tuberculosis. Adults spread the tuberculosis to children, as I told already. Children will not spread the disease to the adults. Now watch for the constitutional symptoms in this case. You have got all the constitutional symptoms, isn't it? Child is losing the weight, child is having loss of appetite, child is not much active, child is not energetic, child is dull looking. Okay. So constitutional symptoms in childhood tuberculosis, always we have to focus more on constitutional symptoms, because presentations may be vary, because childhood tuberculosis pathology is different from the adulthood tuberculosis. In childhood there is formation of the primary complex, and as a result all the symptoms will not manifest. So that's a big problem. Anyway, that we will discuss in another class. Now in this case, cough is mild, fever is mild. So mild fever, mild cough should be always taken seriously. So recent onset of cough with the fever which is more than 2 to 3 weeks is suggestive of tuberculosis. Positive history is also there. So not the recurrent cough and the fever for more than 3 weeks. Now I'm coming to the actual topic. So most of the physicians and most of the mother also have a confusion. Whenever they have got recurrent attack of fever and recurrent attacks of cough, first thing they get into their mind is it tuberculosis? Okay. Now it is very clear how to differentiate a recurrent respiratory tract infection which is coming with the fever with the actual tubercular infection. Now, the recurrent respiratory tract infections are more common because of virus. Okay. Bacteria very rarely cause recurrent respiratory tract infection. Only two conditions are there: either immunocompromised child, or if there is any background cause. Background cause like sinusitis or this adenoids, etc. Otherwise it will not come recurrently, but virus come recurrently. So therefore it is not the recurrent cough and fever for more than 2 to 3 weeks, and child is normal in between the two attacks. This is one scenario. Mother is telling that my child is having recurrent respiratory tract infection with fever, cough, cold, etc. since last 2 to 3 weeks, and he has got similar attacks previously also, but in between the attacks of 1 to 2 months, so he is normal and playful, doing everything, going to the school, but again he starts with a recurrent respiratory tract infection, fall ill. This is one case. Another case is this case, where the problem started, there is no previous history, the problem started now recently for the first time, Since last 2 to 3 weeks, he has got cough, cold, etc. with all the constitutional symptoms, and child is not active in between. Child is not active in between. So this is how we have to differentiate. You know that tuberculosis is a bacteria. In bacterial infection, inter-episodic period is never normal. Okay. See, it is not that a tubercular bacteria, once they enter inside, start doing the pathological changes, it will not take rest in between, isn't it? Okay. So there is no question of normal interval in between. So once it is started, it has become progressive. So this is how we have to differentiate other respiratory tract infection with the fever with the tuberculosis. Constitutional symptoms are very important. Therefore, I say growth chart is very important. See the growth chart. If the growth chart is normal in spite of repeated respiratory tract infection, nothing to worry. If growth chart is falling down by a single 1 or 2 recurrent respiratory infections, you have to be careful. So as a pediatrician, we should maintain the growth chart. That's very, very important. Okay, so this is a case of tuberculosis. So we will consider in Ayurveda under the heading of Raja Yakshma. Of course, Raja Yakshma is not only tuberculosis. Raja Yakshma refers to Roga Raja. So it is Raja Yakshma is a state of immunocompromisation, and a immunocompromised child may lead to different type of presentation. Immunocompromised child is prone to different bacterial infections, viral infections, etc. And one of the presentation is tuberculosis. Raja Yakshma is not tuberculosis. One of the presentation or outcome of Raja Yakshma is tuberculosis. Okay, Raja Yakshma is a immunocompromised state of the person. Okay, or totally immunocompromised state, which can lead to so many problems. So one of the problem is tuberculosis. So that how to treat Raja Yakshma, we have got a detailed explanation in our science. So that we will see in the later classes. Thank you very much for your patience listening. But don't forget to subscribe my channel, and also please give your valuable comments. With another case, we will meet in the another class. Thank you very much.